Hi, I'm Akshay Baheti and welcome to Journal Watch, a commentary on certain important and interesting radiology articles that every radiologist should be aware about. In this video, we are going to discuss about prophylaxis for contrast-induced nephropathy and two landmark articles published in NEJM and in Lancet last year, which shed some light on this topic. So think of a patient who comes to you with poor renal function and we need to give contrast injection. We would really throw everything at that patient in order to prevent nephropathy, won't we? But does any of this really work? Well, two large articles published last year shed some light on this issue. And I'm sure your next question is going to be that there would be evidence to support the prophylactic measures prior to 2017, won't there be? Well, to be honest, there wasn't a lot of evidence. And that is because our concept of CIN or our understanding of CIN is slowly emerging. So we now know that CIN predominantly affects patients with moderate or severely decreased renal function, essentially eGFR less than 60 or perhaps less than 30. Unfortunately, most of the previous studies looking at prophylactic measures essentially looked at all patients, including those with normal renal function, in order to evaluate the prophylactic measure, and hence they were highly biased. So let's start with the first study, the Amazing trial, which was published in Lancet early last year. So they looked at IV hydration using normal saline, the most standard prophylactic measure. We know that this has the potential to prevent CIN. However, at the same time, it does lead to loss of time and money for the patient, and overhydration may actually be harmful as well in some situations. So the question asked by them was whether giving no prophylaxis at all is non-inferior to giving the standard prophylactic IV hydration with normal saline. To answer that question, they gave no prophylaxis in about half the patients and compared them with another half of the patients who received hydration as prophylaxis. And they compared the incidence of CIN in these two groups of patients, besides also looking at the cost of resources involved and accounting for complications of IV hydration which may have happened. The trial included around 660 patients, and these were patients with either IV or intra-arterial contrast injection. And importantly, these were patients with borderline renal function, so the eGFR was between 30 to 60. Around half the patients received IV hydration, whereas the other half received no hydration. And then the trial looked at the incidence of CIN, which was defined as a 0.5 milligram increase in the serum creatinine value over baseline, taken on day 2 to day 6. To cut a long story short, it essentially proved that IV hydration does not work. The incidence of CIN was pretty much the same in both the groups of patients. Importantly, there was no dialysis or ICU admission in either group of patients. Also, no hydration was cost-saving compared to IV hydration, which is not rocket science. And finally, around 5.5% patients did develop complications associated with IV hydration, most commonly congestive cardiac failure. The trial concluded that no prophylaxis was non-inferior and cost-saving in preventing CIN when compared with IV hydration. Let's come to our next study, the NEJM trial. So the Lancet study did prove that IV hydration with normal saline doesn't really help, but what about IV hydration with soda bicarb? Does that help? Luckily for us, the NEJM article was already looking into this question. Also, the other thing commonly used for prophylaxis is oral N-acetylcysteine. And the NEJM study also compared N-acetylcysteine with placebo to see whether it really helped. So this was a much larger study and included almost 5,000 patients undergoing angiography. They had much stricter guidelines about inclusion of patients with renal function, and only patients with eGFR between 15 to 45 were included. However, if the patient was a diabetic, then and a patient with eGFR between 15 to 60 was included in the study. And they used an interesting 2x2 factorial design for the study. So essentially, they ensured that each half of patients received hydration with either sodium chloride or with soda bicarb. And similarly, each half of the patients received either oral N-acetylcysteine or placebo. And what were the results? Essentially the same. There was no significant difference in the incidence of CIN in either group. They also looked at other adverse effects such as incidence of dialysis, death, or chronic renal impairment, and even these were the same in all the groups. So they concluded that IV soda bicarb has no benefit over IV saline. And similarly, oral N-acetylcysteine has no benefit over placebo. So we started by asking this question of whether prophylaxis for CIN really works, and now we do have some clue about the answer. So the Lancet study helped us understand that IV saline doesn't really help. Because of the NEJM article, we know that IV soda bicarb is no better than normal saline, and thus it doesn't help. And similarly, N-acetylcysteine also doesn't help in prophylaxis for CIN. In fact, the up-to-date guidelines have now been updated, and N-acetylcysteine has been removed as a recommendation for CIN prophylaxis. Thus, if a patient comes to you with borderline or poor renal function, we essentially just have to decide whether to give contrast or not. And in most cases, if the eGFR is greater than 30, or perhaps even greater than 15 if you look at the NEJM inclusion criteria, then we do not need to give prophylaxis to prevent CIN. Well, are these findings a little unexpected to you? Not really if you are following the recent literature on CIN. And that's a matter for another video perhaps, but you can read more on why these findings are not that unexpected by looking at this commentary I published recently in the National Medical Journal of India. The links for the commentary as well as the two other articles that we discussed today are there on our blog caferontgen.com. I hope I was able to shed some light on the issue of CIN, and I'm ending with this photograph of the Gateway of India taken earlier this month. Thank you so much and hope you like the video.